Yes. Yeah. Yes. Yes.
seconds. Huh? You've been here since 4 o'clock.
Have you said? Ah, most of you are already. So it's only how many of three of you? Two. Good. Are we ready to go? Big man, I think we will give you only 2 minutes. Huh?
It's too generous. 2 seconds.
Ah,
But yeah.
I said 2 minutes, maybe.
Shall we go now?
We can. Okay. Thank you very much. Good evening to you all. You are all welcome to yet another daily update. This is in fulfillment of the arrangement we earlier made. That is to provide you our regular update. And with us here, we have the Director of Health Services, Dr. Mustafa Bite. And this will be moderated by myself and Mr. Sankano. So we welcome you. Your role cannot be overemphasized. We know how much you are doing in terms of information sharing, and I do hope that that will be continued. We've been engaging you not only here, but even at your respective media houses. You've been providing that support to inform the general public about the danger of this COVID-19. And also the advice we advanced to you is being shared to the general population. So we appreciate all what you're doing, and we hope to continue working with you. So you are welcome. Thank you again. And I have the privilege to invite Dr. Bite to provide you the update as of yesterday. Dr. Bite, you are welcome. Thank you.
Thank you very much. So, good afternoon or good evening to colleagues here. We are here again, once again, to give the update on the COVID-19 response in the Gambia. This is the 24th National Situation Report since the confirmation of the first case of the novel coronavirus disease in the Gambia on the 17th of March 2020. And it reveals the following. 1. Sites have been secured for temporal COVID-19 treatment centers in all the health regions in the country. Western 1 and 2 health regions continue to register the highest number of calls to the 1025 toll-free hotline. The fourth case is still on admission and is responding to treatment. A total of 6 new laboratory test results were received from the lab, and they are all negative. 4 additional people are taken into quarantine. Of this newly quarantined group, 3 were close contacts of one of the recently confirmed cases, and 1 is a Senegalese national who has been evading quarantine after sneaking into the country. Globally, since 31st December 2019 and as of 13 April 2020, a total of 1,929,115 cases of COVID-19 have been reported. This is worldwide. Of these, 119,785 deaths were registered, and 453,018 recovered from the disease. Senegal, our closest neighbors, recorded 291 confirmed cases, 178 recoveries, and 2 deaths. Currently, in the Gambia, we have 56 people on quarantine and one of the hotels in Greater Banjul area. A total of 293 tests were conducted and 9 were positive. 211 were negative. 254 people completed quarantine. 240 contacts have been traced, and 310 completed follow-ups. Regarding the coordination, case management, logistics and security, laboratory and surveillance, and risk communication, the following activities were carried out. 1. Daily coordination meetings ongoing at both the strategic and the technical levels. For laboratory and surveillance, a repeat test on one of the quarantine periods. Regular monitoring of the conditions of all persons under quarantine and regular follow-ups of all persons discharged from quarantine is ongoing. In terms of case management, all cases are admitted at the treatment center in sanatorium, and they are clinically stable and responding to treatment. Regular psychosocial support to health workers and people in quarantine and the treatment centers is being provided. In the area of logistics and security, 150 hospital beds received from an NGO for distribution to the treatment centers. The risk communication and community engagement, 6 TV and 11 radio programs successfully conducted, 37 press briefings conducted, and 11 communities sensitized or engaged on COVID-19 preventive measures using different community structures. Regarding our next steps, the Minister of Health, in collaboration with partners, will intensify the following actions. The Minister of Health, in collaboration with other stakeholders and communities, to continue with the massive sensitization on COVID-19, to continue the follow-up and provision of continuous psychosocial support to affected communities, persons under quarantine, people who are just being discharged from both quarantine and the treatment centers. Initiate community surveillance in all regions with undesignated border villages or posts. Continue with daily follow-ups of low-risk contacts and those discharged from quarantine. Encourage public reporting and self-reporting of high-risk individuals through the toll-free line. Engagement of inspectors of the State of Public Emergency Regulations 2020 and documenting best practices of compliance while identifying challenges that require urgent attention in the interest of public health. Finally, I would like to thank the National Assembly Members Special Select Committee on the implementation of the State of the Public Emergency for the interactive session with the Minister of Health and partners at the National Assembly earlier today. This meeting gave us an opportunity to update the lawmakers, who are the representatives of the people, on the current state of our national COVID-19 response. I would like to conclude by commending all communities that establish and support the work of the community vigilantes in tracking people entering in the Gambia from affected countries and communities along the borders. The Ministry of Health salutes the important community initiative and will urge all communities in the country to embrace and establish such community COVID-19 monitoring structures. Community participation and involvement in COVID-19 interventions is essential. Together, we can fight against COVID-19 in the Gambia, and we thank you very much for your kind attention.
Thank you very much, Dr. Biti, for that update. Now we will have Mr. Sankano, who will moderate, will entertain few questions, and he will moderate that.
Thank you very much, Deputy Director of Public Health Education, Sanjali, and thank you very much, Dr. Musa Bite, for that important update. And as noted, and in the statement, it's important to know that the Gambia government to suspend all foreign trawlers from entering Gambian waters, including foreign vessels with valid licensing from operating in Gambian waters. This is as part of measures to control our borders. On that note, I'd like to invite a few questions, your media house, and your name. Questions in local languages are also welcome.
We understand from your last update, 5 new cases included some people who completed the quarantine period. Later on they were tested and happened to be positive. So based on that, it seems like there is a bit of lapses in the situation, of which the Director of Health Promotion and Education said if there is indeed a lapse, so the period of quarantine will likely be extended to 21 days. So how far is that done at the technical level of the ministry? So the next question is, we just want to know, is it not possible to test all those people in quarantine to avoid some of these people graduating from quarantine situation and then only to become positive again? Maybe the other questions quickly, just the last question, I will make it in two form. I visited the border post at Jiboro, and I found the health unit there is not that much sophisticated. So what I understand from the health official on the ground is even the community is looking up to them to have some sanitizers and materials. So how assured are these health posts in all the border posts seriously sophisticated, especially with the materials that the ministry continue to say that is available? So in Tanje, just quickly,
Thank you
just
very
do
much,
you
Dr.
want?
Bidekhan. Give me a chance to answer. If you load too much questions, it will be lost.
So thank you very much for the questions. The first one is that there seemed to be a lapse in the quarantine, and this was discussed because I think you need to remember that the WHO regulations says that if you get someone, let's say coming from a hotspot, and then the idea is to keep them in isolation. It could be mandatory quarantine or it could be home isolation. In Gambia, we are saying that to be strict, to be able to observe these people very well, looking at our cultures, that sometimes in Europe 3-4 people live in one house, but in Gambia it could be many. It could be 8, 12 or more. So it was agreed that any case that's coming from a very hotspot area, you have to undergo mandatory supervision and mandatory quarantine so that you are checked every day, you are seen, so that once you get the symptom, it's detected early. But the regulation about that is after 14 days, if you don't show any symptoms, you should go home. You should go home. But the Gambia, we've been doing always extra. So whilst we were discussing, because the evidence is that if you do a lot of testing for those who are under quarantine, then you will finish your test and you will not get any results. So the idea is, if you do your quarantine, they are not symptomatic, leave them to go. That's the regulation. If they start to show symptoms, you test them quickly, and that time you catch them and all. But the things are evolving, and as a technical group here, we've been discussing and saying, look, this doesn't look like it's the best. Let's test them. So, but by the time we make the decision, some people have already been discharged. And so it was the initiative of the ministry to decide that, look, even though this is what the regulation says, but we think we have to be a little bit more aggressive. So let's go and test this. So that's why some of them were called back and tested. And out of that proactiveness of the ministry, you get 3 of them positive, 3 of those who were discharged. But the other 2, because we've changed the policy, that now everyone who is in quarantine will be tested. So those two, you realize that we are still in quarantine. They were left with few days, so they were tested. Now going forward, we've made the decision that, for your second question, everyone in quarantine will be tested, because we've seen the evidence. But if we had done all this we do for 200, 500 people, and we did not see any evidence that is yielding fruit, then we would have been wasting our tests. But now we've realized that this is a very good move, and it should be taken up. And some people are telling us that you need to share this idea with other countries, so that they will also maybe test all these people. You don't see it as wastage of testing. It can yield fruit. Because if all these 3 people went back to their community and they start to spew the virus, then they are spreading it. And so I think it's a good initiative. And now what is happening is we are going back to all those people who have been released and getting them and try to test all of them. Some of them are already out of the country. They are in touch with them. And they know that some are out of the country. And the idea now is to see everybody who has been quarantined to be tested. So this was the issue with this one. Yeah. The third question about the border. So yes, yes, the borders. This is screening. So for this disease, what we need to do is to just have the. We've been discussing. Many people are a bit apprehensive about the disease, but if you go by the guidelines, there are certain people who are in the front line who needs to put on some PPE. Sometimes just a mask. Sometimes it's just so it's not. So what we've been saying all the time is that, like for example, the one doing the screening can be in the forefront, screen everyone and assure that they are fine, then before the others can do. So the screening things are available, and the PPEs and required is always available. It's already recently the director of pharmaceutical has gone around the whole country, talked to people and put all these things in each of the regions. So, but usually you don't take it to the individual. You put it at a place in the region, at the central region, and people come for it as they need. So sometimes if you go and give all to one place and then they are not using it because it's not required that much, and it will not be judicially utilized. So it's best to put it at the center and people request as they need it. And that is what is happening at the moment. Thank you.
Thank you. One more last question. If we're taking 3 questions, one more and then. Okay.
About the foreign vessels and vessels that are licensed in the Gambia. Okay, first, vessels most of the time that comes to the Gambia bring what is categorized as essential. It's either food or fish, to my understanding. And in this aspect, if actually all those vessels that are coming to the Gambia are actually stopped, have you made a prior assessment to understand clearly when it comes to the fish need made in the Gambia and when it comes to other foodstuffs like sugar and other things that are imported? Have you made a prior assessment before you put up this law or not? If no, are you also not considering probably the corona can lead into a more deadly situation than the corona itself? If yes, can we get the figures of estimately how long can people live with the available foods in the Gambia?
Well, thank you very much. What I can say is the language, the official language of the situation report. It says, I repeat, government to suspend all foreign trawlers from entering Gambian waters, including foreign vessels with valid licenses from operating in Gambian waters. Talk about foreign trawlers. Foreign trawlers that come, fish, and take it away. The fish that they fish is not sold into the Gambian market. It's for export. So that's the difference. So we have a lot of barras and local fishermen who can still supply the market. So the government did assessment, and that's why they closed the land and air borders and monitor the development in the sea level. And we've seen that people are trying to sneak through the sea. And as a responsible government, we have to take an action. So I'm sure that the essential commodities team is that they look at it and they'll be able to they will advise appropriately before this decision is made.
So just a clarification.
Yeah.
If we talk about foreign vessels, these are vessels that are not in the Gambia. Vessels licensed in the Gambia, some are discharged, some discharged in the Gambia. Not all vessels that are licensed in the Gambia are discharging outside the Gambia. Most discharge in Senegal, but some are discharging in the Gambia.
What we are saying that the language says foreigner from entering Gambian waters. So if you want specific information, you contact the Gambia Ports Authority, which has the mandate to interpret. The government makes a decision and there are technical entities that interpret it into action. So the Gambia Ports Authority, the Gambia Maritime Administration, which is in charge of administering the water bodies, the waterways in the country, can give you a better explanation how they are going to apply. So I think that's very important. On that note, we wrap up today's final question, please. Tomorrow.
Okay, thank you. Last time you told us that when people are so with regards to the money, which was given to the health ministry by the government, but we are yet to consume any information regarding that money. And second, one of those under quarantine or one of the new victims released an audio denying that she tested positive in this coronavirus. What is your take on that?
The first question I can ask about the figures, and like I said, the last time you asked, we told you that the question was posed at the National Assembly, and the Minister of Finance responded. As Dr. Bitte noted, we were at the National Assembly today to update the Special Select Committee on the implementation of the state of emergency. Our permanent secretary, Mr. Mohamed Lamin Jaite, did a wonderful job in giving a breakdown of how much money has been received so far and how much is outstanding, and the checks and balances in the place. The information is being submitted to the National Assembly member. And once they get it, then it will be available. They are the representative of the people. So that information, once the National Assembly members, the Select Committee digest it, then it should be available in the public domain. So on the second question, I hand it over to Dr. Bitte about this quarantine denial.
The one who tested,
or Dr. Bitte, or
who claimed that he is not tested positive.
So, thank you. So this is a very difficult period for all of us, and this is not new. If you have in medicine, we talked about giving bad news. It's a whole model on how to train people to give bad news. Like if somebody is in the hospital and the mother dies, for you to break the news, there are steps you need to take because they go through processes. Grieving, you go through processes, and one of them is denial. And sometimes you rationalize. So this is what we expect. That's why we have the psychosocial unit with us. If we don't have this, then it's not normal. If you are told, for example, that you have certain disease, you have cancer, or some people, they have to say no to that first. They have to go through a process, 6 steps in grieving, and before they can come to terms with it. And what we are saying is the society should be so compassion, because even if you are from, let's say, America, Europe, you come to Gambia and you are put in a 5-star hotel and you are asked that you are not moving, that alone is restriction of your movement. Even if it is in a 5-star hotel, you will not want it. So this is something we expect, and we expect that we know how our people are trained, the doctors, the nurses, and the health workers. They should take care of these things. So sometimes it takes a long time before somebody accepts it. And what we need to understand is this disease, 80% of the people who have it, they have mild disease. It's not serious. So you can have it, you will not have any symptoms, or you have mild symptoms, and you go through it throughout, no problems, 80%. So that's why in other countries they are telling the youths, don't be so wicked. Don't say that because the youths don't die too much. Even now it's changing. But before, all the youths were going out thinking that it was only killing mainly the elderly. And so they don't mind, they were going playing football and all, and exposing, making sure that the thing is going everywhere, and then they are exposing the elders. But now we are saying that even though now it's still more dangerous, or the mortality is higher among the elderly, but we are seeing youths also. Even now we've seen a little bit of kids, children. It's rare, but even now some kids are dying. So it's important to understand that you can have the disease and it's mild. So you don't say because I'm not coughing or I'm not this. You are tested. If you are tested, you are positive. The best thing you can do for the country is to just stay away. Make sure you go through the process. If you are young and you go through it and you don't infect any other person, that's the best thing you can do for the country. Because the next person you infect, you don't know how many other people he's going to infect. So that's why the government and the laws and the people give us the right to be able to take these people, even though against their own will. Which is very difficult. We don't like doing that in our normal practice. But this is for the greater good of the country, and that's why we are doing so. We will want the compassion of the community to understand that this is a process that most people go through, and people go through it in different ways. So some people, you tell them bad news, the way they will react is different. And some people, that's why people are trained on how to deliver these things. Thank you.
Thank you very much, Doctor, for that elaborate explanation. As you say, it's affecting the youth. As you said, the latest report figures show that the youngest victim is 20 years old. But for privacy protection, the government doesn't reveal private names, so it's important. And I'm appealing to all the media organizations to respect that one. We respect the privacy of the people. All information that are released are based are anonymized in the public interest, but releasing people's names, and it's not something that is unethical, and it's an issue that has been raised by the National Assembly. They are representing the people, and it's important, you as our partners, let us respect that ethical principle. You will not like your medical information to be on social media everywhere, and let's respect that. And another thing is, let's fight against stigma. One of the reasons why there's denial rate is high is because of the stigma. This is not a death sentence, and no one is to blame. It's not a crime to have it. So therefore, let's fight stigma and discrimination, and let's respect privacy. The fact that we are not seeing dead bodies in the street, that doesn't mean that it doesn't exist. We are respecting the privacy of the people. On that note, thank you very much for coming, and see you tomorrow for another update. Dr. Bite, thank you very much. And Deputy Director of Public Health Sanjali, thank you very much. And the team, the media corps, it's nice to have you. Bye-bye.